My name is Suzanne Wikle, and we're pleased that you're joining us today for the next webinar from the Elevating the Medicaid Enrollment Experience Project. I'm joined today by Farah Erzouki from the Center on Budget and Policy Priorities, and we'll be tag teaming the presentation today as we kind of talk through both the current context and some other things. Farah, do you want to advance the slide? Oh, and just so everyone knows, we will be emailing out the slides and a recording of this webinar. So our agenda today is pretty straightforward. First, of course, why we're focusing on renewals, why we chose to do this at this time, the current context, particularly with the maintenance of effort implications. There's a lot going on in that space. Then we'll dive into just kind of really basic things about Medicaid renewals to bring everyone up to speed and make sure everyone has a very concrete, basic understanding. We'll talk about specific advocacy opportunities that you can think through for your state, and then just wrap up with some next steps and resources. So first of all, why focus on renewals? I think especially at this time frame when we know the maintenance of effort is in place, and Farah will dive into that in a moment, but really why focus on renewals now? And we think there's many important reasons. One, it's a critical point in the Medicaid process when people are at risk of losing coverage. We know that inefficient renewal processes contribute to churn, which is detrimental to both people who need healthcare and are accessing Medicaid, and also to the state and administrators who are running the programs. Thirdly, there are a lot of advocacy opportunities in this space to improve the renewal experience. And lastly, but of course not leastly at all, is we think this is part of important racial equity work. And that is actually where we're going to start talking in the presentation. So I pulled this quote from an article I read recently that talked about administrative burdens as racialized and as racialized burdens. I'm just going to read it quickly and then have just a couple of short comments on it. We intuitively understand such hassles, administrative burdens, to be irritating, but can easily miss the scale of their impact and the extent to which they are targeted at certain groups, particularly Black, poor, and disabled Americans, and especially women. And obviously this quote isn't specific to renewals, but it speaks to administrative burdens more broadly, which is very applicable in this space. Because successful renewals often boils down to minimizing burden and the administrative burdens that come with that. And we've seen a lot of progress in this space over the past years, particularly with what the ACA brought to this space, but there are still significant barriers and burdens. And the reality is that the populations named in this quote are those most likely to manage those burdens, to have to manage those burdens, and to have to navigate the system in order to keep their health insurance and have access to affordable health care. And just personally, something that I've been thinking about recently, and particularly in preparation for this webinar today, is thinking about over the past year that the maintenance of effort has been in place for Medicaid, that in a lot of ways, many of these hassles and administrative burdens have largely been erased over the past year. And I think as advocates, we can take a step back and think about what lessons can we learn from that from an equity standpoint to really think about the value of continuous coverage and what lessons we can take from that and hopefully apply post maintenance of effort. And with that, I'll turn it over to Farah.
Great. So piggybacking off of Suzanne, it's important to note that these inequities are not new. They're part of a larger system of racism in this country. These administrative barriers and systems have led to communities of color facing, for example, disproportionate representation in Medicaid due to lack of equal opportunities. This means that any policies that make it more difficult to stay covered will impact communities of color disproportionately. Communities of color and immigrants also are overrepresented in work that has hourly wages and are more likely for income to vary in these jobs over the course of the year. These fluctuations may lead to additional burden and make it more difficult for populations to provide the documentation needed to renew their coverage and stay covered. Increased barriers to renew Medicaid can also lead to communities feeling a sense of shame in accessing these programs in the first place, which leads to increased mistrust that already exists in communities of color of government and government programs. Administrative burden is also exacerbated by existing policies like public charge and the buzz around Medicaid work requirements that increase burden of paperwork and reporting. So all of these things combined make it really difficult for communities of color to stay covered. So moving on to the current context of renewals, as discussed in our recent webinar on unwinding the continuous coverage provision, the maintenance of effort has been in place since March 19th, 2020. And this created the continuous coverage provision where for a 6.2% increase in the federal match, states must maintain people's Medicaid coverage through the month in which the PHE ends, and with some exceptions noted on the slide. The Biden administration recently notified states that they expect the public health emergency to last at least through the year of 2021. And that means that the continuous coverage provision will actually last at least through the month of January 2022. And so this gives states really valuable time to start thinking about how to unwind effectively. And it'll take some time for states to map out that strategy, so they need to start thinking about it now. And so states can both improve current processes and make processes easier so that eligible people can stay covered when the public health emergency ends. And so renewals have definitely been impacted by the current public health emergency and the maintenance of effort. And now is a really important time to work with your state to improve the renewal process. So state responses to the continuous coverage provision have definitely varied. Some states have stopped doing renewals altogether, while other states have been processing renewals and starting a new eligibility period for folks who are still eligible. And although those states can't act based on findings of ineligibility, the best practice is for states to be conducting renewals whenever possible to reduce the backlog they'll face when the public health emergency ends. And states should also maximize their use of ex parte renewals. You'll hear more about the ex parte renewal process shortly, and in our next webinar, we'll do a deep dive on the process, but states can improve certain processes now and increase the percentage of ex parte renewals, and we'll touch on that later in this presentation. Another way to, and this is another way to reduce backlog with nothing required from the enrollee as well. So as we also mentioned in our unwinding webinar, CMS released guidance on December 22nd on how states can most effectively resume normal operations after the public health emergency. It's important to note that this guidance may be updated by the new administration, so some things might change. For example, CMS is currently giving 6 months for states to catch up on their workloads. We hope to see this increase to 12 months to align with states' typical case renewal timeframe. However, this guidance does actually provide some important streamlining policies for both during and after the public health emergency. So some policies during the public health emergency, as mentioned, are maximizing ex parte renewals to reduce backlog. States can also consider coordinating with SNAP during the public health emergency. So sometimes the SNAP program has more updated enrollee information, and that information can be used both for processing Medicaid applications and renewals when the enrollee is enrolled in both programs. There are also a number of policies that states should be implementing after the public health emergency, but also preparing for them in the meantime. One point to caution is that although states can't terminate based on findings of ineligibility, although states can terminate based on findings of ineligibility within the 6 months prior to the end of the public health emergency, states should avoid doing this. We don't know how long the public health emergency is going to last, and information will likely be old and outdated by then. So states should conduct fresh renewals for those due for review in order to be the most accurate. CMS also doesn't require states to conduct full renewals at the end of the public health emergency, but states should utilize full renewals when they can, as opposed to data matches that provide a very limited time frame to respond and require more information from the enrollee. And Suzanne will talk more about what a full renewal looks like very shortly. States should also stagger their workload over the full 6 months, not only to make it more manageable, but also to avoid having a disproportionate number of people renewed within a small time frame. States should also take a risk-based approach when conducting renewals. So prioritizing cases that are most likely to be ineligible first, and making sure that vulnerable populations that are most likely to be eligible are conducted on the back end and towards the end of the renewal period in order to ensure that vulnerable populations are less likely to be kicked off or lose coverage for procedural reasons. And so I mentioned coordinating with SNAP during the public health emergency, but states can also do that after the public health emergency and take information from the SNAP program in order to streamline the renewal process with Medicaid enrollees as well. So I'll go ahead and pass it over to Suzanne to talk about the renewal process.
Great. Thanks, Farah. And I think it's just really important for us to just take a moment and recognize that this maintenance of effort has been in effect for a full year as of tomorrow, which is really monumental. I mean, we haven't seen this type of continuous coverage for Medicaid and the scope ever. And I think it's been really fantastic for all the communities you guys are advocating on behalf of. And I think, I mean, personally, I just sit back often and think just how incredible it is that it's in place. But unfortunately, we know that one day it will come to an end and states will resume normal operations, including what that means for renewals. And I really want to underscore what Farah said about states still doing renewals during the maintenance of effort, but really only acting on the ones that are positive and not disenrolling anybody. So as we think about both preparing for the unwinding of the MOE and also once the MOE is gone and the states are back to, quote, normal operations, our goal here is to just give you guys a really basic framework of the renewal process, things to think about in your state, and just that framework. Next slide, please. Sorry, can you, thank you. So just quickly, frequency of renewals. For the MAGI population, we're talking about every 12 months. Of course, there are a handful of states, well, let me back up for just a second. So we're talking about every 12 months. Some people may say, wait, my state does some checks like in between. If states are choosing to do, you know, data checks during that determination period and reaching out to people to clarify information, that's not really what we're talking about today. We're talking about the full renewal process at the end of an eligibility period. And importantly for that MAGI population, any months of coverage that were provided as retroactive coverage do not count in that 12 months of eligibility period. And then for the non-MAGI population, it's really determined by the states and can be up to 12 months. Next slide, please. So what information is and is not necessary for Medicaid renewal to be completed? So really simply, it makes a lot of sense, is that what is necessary is eligibility criteria that is subject to change. And that's most likely income. That's what we see, you know, across the states, is that the number one thing that changes, that needs to be updated, is income. And what information is not necessary to complete is anything that's generally not subject to change. So, you know, things like citizenship, immigration status, residency, kind of all those things that don't change on an annual or a monthly basis. Next slide, please. So timeliness of renewals. States are required to allow adequate time to complete the renewal process by the beneficiary before the end of an eligibility period, and that's generally deemed at least 30 days. Importantly, if somebody doesn't make that deadline of returning documentation by 30 days, but they still return the renewal form and documents before the end of their eligibility period, the state must act on that information. It must process that information and continue to provide coverage until all of that information is evaluated. So Farah touched on this in what she spoke about with the MOE and really maximizing ex parte. I think across the board, when we think about Medicaid renewals, one of the really great opportunities states have is to leverage information that other programs that they administer has. SNAP is often turned to as the program that has some of the most updated or most complete information to turn to. And there's a couple ways that SNAP can be used specifically as a data source for Medicaid. One, just very simply using what information is in the SNAP file regarding income or other pertinent information can be used. And as far as said, that information is often more updated than the last information provided to the Medicaid agency. States also have an option where they can use SNAP data, and they're allowed to identify a group of SNAP recipients that are certainly eligible. There's criteria that kind of outlines what that certainly eligible is for Medicaid, and they can use that to keep people renewed in the program. And then the last bullet here, express lane eligibility available for kids. This allows states, if they adopt this option, to renew Medicaid simply based on the fact that a child or children in the family receive SNAP, and in some instances other programs as well. Next slide, please. Okay, so those are kind of the basic, this is what's required, this is what states can do. So what does the process look like? To build on what Farah was saying earlier, so states are required to attempt what's called an ex parte renewal before reaching out to a Medicaid beneficiary and asking for any sort of information from them. How do they do this? So states can access electronic data sources to look at income, other criteria, and if everything looks like they're still, eligible, the person is still eligible, the household is still eligible, the state can send to that household or that person a notice that says, this is the information we looked at. This all indicates that you're still eligible for Medicaid. If this information is incorrect, please contact us. But if not, you've been renewed for 12 months and your next renewal date is such and such. If the data sources do not confirm ongoing eligibility, then the state has to pre-populate a form to send out, meaning that they are supposed to fill in as many blanks on that form as they can. And we'll talk a little bit about that more in a second. And it takes action by the beneficiary to complete the rest of the form, gather any other documents that they need to, and submit those back to the agency. In the next webinar that we're going to be doing, that's going to really take a deep dive on the ex parte process, because there's a lot to unpack there. We'll go into detail more about what does indicate and what does not indicate ongoing eligibility. Okay, next slide, please. So as I was saying, if the ex parte is attempted, but it's not successful for whatever reason, the agency must send that pre-populated renewal notice. I think this is a really important question here for your states. What are they pre-populating in those notices? Some states maybe just fill in name and address, but not income or other information they have on file. Other states really do their best to fill in as much information as possible. So if that's not something you know about how your state fills in those pre-populated forms, that's worth looking into a little bit. The beneficiaries must be given 30 days to return the information. And I think, as I think about the end of the public health emergency and the maintenance of effort, really thinking about one of the questions is, what are states doing to update addresses and stay up to date with current addresses for beneficiaries? And this is going to be really important because, people have to receive mail in order to return it on time. So that's a key question to be thinking about as well. The agency is required to allow renewal by mail, phone, online, and in person. I think a couple questions for you to think about for your state is, particularly for online submissions, how complicated is that process, or how simple is that process? Is the user, or most states have some sort of user portal, and is that really truly user friendly, or is it somewhat cumbersome to use your account through that? And for phone renewals, they must take telephonic signatures, so it must be able to be completed via the phone. We put minimize verification requests on here. So it sounds simple, but really this is kind of what it all boils down to and is so important. So just to make sure we're clear, when we say verification requests, we're talking about, requests to send in paperwork to prove some sort of eligibility criteria. And verifications or paperwork is really the main cause of renewals not being completed. Those are the barriers that get people hung up. We know people face a lot of barriers to tracking down paperwork and submitting it, and too often this just leads to a renewal not being completed. So figuring out if the state is requesting verification that it doesn't need to request is very important, because we want to eliminate any of those verification requests that are not absolutely necessary for the renewal to be done successfully. And then when verifications are required, which they legitimately are, ensuring that people are able to submit them through all available avenues will really help get those renewals finalized. So that's, you know, all the things like online, maybe through an app, in person, any avenue that somebody needs to submit those, we hope are available to them. Lastly, importantly, when the ex parte process fails and the state must reach out to a beneficiary to complete a renewal, the state can only ask for information that, one, is subject to change, as we discussed, is necessary to determine eligibility, and cannot be verified based on available data sources. So this really means that states should not be asking people to submit information that can be accessed through available data sources. I think, you know, states, some states do this, some states aren't as great at it, but it's something to really think about in your state in terms of, are they asking for information that they have somewhere in a database that they could access? And then beneficiaries should be given an opportunity to re-enroll without a new application. So if they return their renewal paperwork, you know, past their eligibility deadline, and so they lost coverage, but it's within 90 days, the state needs to act on that renewal paperwork without requiring a full new application. Okay. Thank you. So if someone is found ineligible before they can be terminated, the state has to assess them for whether they are eligible under a different eligibility category. If the state identifies another possible eligibility category, but the state needs more information, it's required to give the beneficiary a reasonable amount of time to provide that information. And during that time period, coverage must continue until the information is reviewed and the person is found ineligible for that possible other category, or unless the person doesn't return the requested information within the time period provided. Next slide, please. So those are kind of all like the rules. This is how it should work. This is what we want to see. But obviously how it plays out on the ground and in the states varies, and there are different things for people to look at and to explore. So number one, how does the state define ex parte, and what data sources are they really using? I think for me, when I think about this, I think about it in terms of really how hard is the state trying to complete renewals by ex parte? Are they really putting all their resources that they can in that space and doing really well, or are they kind of, they're trying, but they could do a little bit better? And think about, you know, where your state falls on that spectrum and what can be done to improve it. As I mentioned, when they send out a pre-populated form, what is that? What are they really pre-populating? Are they really making it as simple as they can from the beneficiary end when that form arrives in the mailbox? And then the different avenues required for submitting applications and renewals is that, what does that really look like? How easy is it? You know, does the call center have somebody that can complete this step the first time you call? Are you rerouted to somebody else? Are there long wait times at the call center? You know, online, is the website easily accessible? Is the website mobile friendly for, you know, phones or tablet use? In-person offices are, obviously right now, in-person offices are a completely different ballgame than they are in typical non-pandemic times, but you know, are those open hours that people can access them? Are they in communities that most need them? You know, kind of what does that distribution and access look like? And with that, I will turn it back over to Farah.
Great. So moving on to advocacy. So as Suzanne kind of started talking about, there's a lot that advocates can do to improve their state's renewal process, and that starts with gathering information. So advocates can review their state policy, which looks like looking at what data sources are used for renewals and what the state's reasonable compatibility policy is, among other pieces of information that can help paint a picture of what the state's renewal process looks like. It's also really important to find out what's happening on the ground to get a full understanding of what people are experiencing and hear the perspective of enrollees. So this looks like talking to people who are going through the renewal process and see what it looks like in practice. It looks like looking at notices and forms that people are getting in the mail and being asked to complete in order for their coverage to be renewed. This can give you insight into the renewal process that might not be apparent just through your own research. So once you have some of these key pieces of information, then you can find important data on your state's renewal process. And you might need to ask them for that through a data request. So some important data points that you could ask for include, for example, reasons and codes, reason codes for case closures. So why were people disenrolled, for example? Are these reasons procedural and could they have been avoided? What's the success rate for ex parte renewals? And what is the reason that ex partes are unsuccessful? And this can help you understand if there are systemic issues that are preventing large numbers of enrollees to be renewed ex parte. And so then you can more effectively address them. And lastly, how has application volume during the MOE differed from historic application data? So this might be able to tell you if there's, for example, high amounts of churn occurring outside of the public health emergency. And that's when people lose Medicaid and then re-enroll within a short period of time. And this is largely due to administrative issues like paperwork and temporary fluctuations in income. So these sorts of things can kind of help you understand what's happening in your state with the renewal process and what's working and what isn't. And so once you have that information in the data, it's time to advocate. So based on what the data tells you, there may be several things for you to advocate for. And broadly, they fall into three main buckets, which are operational, policy, and systems or IT changes. I've included a couple of examples of each on each slide. On this slide, it's not at all meant to be an exhaustive list, and a lot of options in these buckets might be state specific depending on what you learn about the renewal process in your state. But let's go through them. So for example, operational changes. So this might look like looking into how the call center handles renewals. It also might look like expanding work communication methods to notify enrollees of updates or changes, such as text messages or calls instead of just sending notices in the mail. This might also look like policy changes. So for example, ensuring there's a correct reasonable compatibility policy and that the state is actually following it correctly. And there will be more details forthcoming about reasonable compatibility on our next webinar. It could also look like changing what data sources are used by the state agency for the better. And lastly, there are systems and IT changes. So for example, this could be allowing more to be accomplished through a user portal or making it more user-friendly and so on. This could also look like making sure that there aren't any systematic hiccups on the back end that might impact large batches of enrollees. And once you have information about your state's renewal process, if you're feeling stuck about what the best course of advocacy is, please feel free to reach out to the ME team. We're always happy to chat with folks and think through this stuff. And lastly, there's a lot that advocates can do right now on resuming normal operations after the public health emergency. As I mentioned, it's really important to start the conversation with state officials now about whether they have a plan and what they're thinking, and open the door for the conversation about this throughout the rest of the year. So in general, this could be asking, whether the state has a plan yet. Have they looked into what they plan on doing? What does it look like? So for example, we've been hearing that some states are creating termination lists of folks who were determined to be ineligible during the public health emergency. And a lot of times, because we don't know how long the public health emergency is going to last, those findings could be outdated. And so you could encourage your states to avoid using them. You can also see if your state has started to process renewals and find out what information, if anything, that they're currently sending out to enrollees. And if you combine this type of research with conversations on the ground, as mentioned, to see how effective these communications actually are, that'll make your advocacy even stronger. You can also work with them over the course of the next year on policies that would retain coverage for eligible people, as we've mentioned throughout the presentation. So promoting things like maximizing ex parte renewals and staggering workloads and so on. Also making sure that they are communicating with enrollees in a positive way on what to expect and what documents they need to provide to process renewals ahead of time, so that the enrollees are aware of what's needed from them and when that time will come. And lastly, to promote the full use of renewals when the public health emergency ends, as we mentioned as well. So it's really critical to start those conversations now with states to ensure they have a plan to address those changes after the public health emergency to be able to conduct renewals as effectively as possible. So with that, I'll go ahead and turn it back over to Suzanne to wrap us up and talk about next steps.
Thanks. Next. All right. So as we mentioned, and as you gathered from today, the ex parte process is really critical to how successful Medicaid renewals are and how the state is doing. And we are planning a very in-depth webinar on ex partes that will be in April. So please keep an eye out for that. If you're not on the ME email list, be sure to reach out to one of us to make sure that we can get you added to that. In the slides that we send out, we'll have links to other ME resources, previous webinars, and some papers. And then as Farah mentioned, really, we encourage you to be in touch. We're here to help you guys sort these things out in your state. So as you come up with questions or you see data from your state that you just want to talk through or you want some help thinking about or analyzing, please reach out to us because that's really what we're here to do. And then on the next slide, we've provided a few resources that we think will be helpful. So the federal guidance on renewals that came out last December, which again, we are, kind of waiting to see if we see updates to under the new administration. There's a 50-state report that many of you are probably familiar with that's put out by both Kaiser and the Center for Children and Families at Georgetown, and we've put the link to the latest one in here. There's a Medicaid renewal brief that's short. It's 2 pages front and back, and it's kind of just a very high-level glimpse of the renewal process, and it's a great tool to have easily to access when you need to. And then, again, I think maybe we put the guidance on here twice, but it's all there for you guys to access, and we'll have links to this when you get the slides sent out to you. And then lastly, before we get to questions, I just want to make sure everybody has our contact information. The ME team is Farah and Jen Wagner from CBPP, and then myself from CLASP. And as we said, we're happy to help anybody work through these issues in their state. We love having these conversations with state advocates, and so we really welcome you all reaching out to us. And with that, I think that we are ready for questions, and I think Jen's going to join us for some of that discussion as well.
Great, thank you. So we do have a couple questions that came in. As a reminder, if you'd like to ask a question, click on the Q&A icon in your control panel and just type your question into the box. So the first question is regarding the December guidance. Is the 6 months for states to catch up on workload in the December 22nd guidance? And is it 6 months after the guidance was issued?
So yeah, the guidance on December 22nd did indicate that states would have 6 months to catch up to their workloads, but the guidance says that it's 6 months after the end of the public health emergency. So 6 months after the month in which the public health emergency ends, not 6 months after December 22nd of 2020.
Great. And would tax filing status be something that is subject to change?
So that's a tricky one, especially as it relates to the ex parte process. So CMS has said that states can presume that household composition has not changed. Because if you think about it, if you would have to re-verify household composition, pretty much no case could be renewed ex parte because there is not a reliable electronic data source to verify household composition. So for purposes of an ex parte renewal, you presume it hasn't changed. Now, when you a state sends out a pre-populated notice to a household, they would say, these are the household members we have. Has anything changed or has tax filing changed, status changed? So you would ask that, but it wouldn't be something that you would have to verify or always require them to answer.
Our next question comes from Kentucky. Kentucky doesn't postmark any Medicaid notices, and they often hear of letters being received after the due date. Does CMS require states what does CMS require of states in terms of timeliness and grace periods?
So that's definitely challenging. The federal regulations around renewals say that it's 30 days from the date of the renewal notice that clients must have. So that's unfortunately a little bit vague. So with postal delays and even like state agency delays, that can mean that clients have less time to respond than they should. If they're actually receiving the renewal notice after the due date, there's something more fundamentally at play here, because 30 days is a heck of a lot of time for delays in the postal service and otherwise. So what I would recommend is, if you have concerns about that, to ask your state, especially since you fortunately have a fairly friendly administration, to walk through the process with you. Okay, how many days before the certification period ends do you attempt the ex parte process? When does that conclude? And do you know that people that need a paper notice? When does a paper notice get mailed out? And when is it generated by the system? When is it printed? When does it actually leave the mail shop? And kind of map those things out to see when it actually reaches somebody. As Suzanne pointed out earlier, if the renewal form is received even after the due date, but before the case is closed, the case should remain open until that renewal form has been processed. And should the renewal form be returned after the case has closed, there is that 90-day reconsideration period, which means that the state must take that late renewal form and reopen eligibility if the client remains eligible based on that, without requiring a brand new application.
The next question is regarding MAGI population. So most of this discussion of renewals centers on the MAGI population. What about the non-MAGI cases?
I can jump in on that one too. So again, the regulations do require an ex parte process for non-MAGI as well as MAGI, but that is if the eligibility can be verified through electronic sources. And because a non-MAGI population has an asset test, it has actually often been excluded from ex parte renewals. States say, well, we can't verify assets, so we can't do ex parte. However, there is a new requirement on asset verification systems that states have implemented, and they should be able to electronically verify asset eligibility based on cross matches with banks. That should move the non-MAGI population into the ex parte process. But that's a ripe area for advocacy. In some states, non-MAGI is in a legacy system with SNAP and other human service programs, and there's no programming for ex parte. In other states, it's just kind of forgotten and left behind. So there's a huge opportunity there to push for more non-MAGI ex parte renewals, and otherwise, carry over the streamlining process from MAGI to non-MAGI. The pre-populated renewal form, the 30 days to respond, the reconsideration period. There's actually a lot of really good information in that December 22nd guidance that promotes some of the streamlining for the non-MAGI population as well. So coming directly from CMS, even from the former administration, that could be a good hook for conversations with your state agency.
And a question has been raised about the way that agencies communicate with beneficiaries. So most federal agencies rely on written communications through the postal system, but there's been a lot of progress made with technology. There's a worry that the postal system takes a long time, but technology is open to hacking. What are your thoughts on this?
Sure, I'll jump in on that one. So I think in the context of Medicaid, we're going to be talking about state agencies and their communications with people who are renewing Medicaid. And I think first and foremost, we want to make sure they're only reaching out to people if they need to be. So they should really be maximizing that ex parte process that we talked about to pull data from databases that exist to indicate whether or not people are still eligible. If they do need to reach out to people, I think as we mentioned, it's important to make sure that as many avenues as possible are open for people to both receive information and return information to the state. So, some people are going to be more computer literate than others. Other people will like the phone. Other people prefer, snail mail. So I think they all have their pluses and minuses, but I think the important thing is ensuring that there's as many avenues available to people to use.
And are there any best practices from states that you can cite, or research on best practices in general that they can use in their advocacy?
So that paper that was listed on resources, I believe that's one that details a little bit about the renewal process and considerations for states, best practices as far as things we've covered in this webinar, pre-populated forms, multiple modes of submission, all of those things. So that's a brief paper with some best practices. And then there's also a more detailed ex parte renewal paper that CVPP released about 2 weeks ago. And that goes into a lot of considerations for states on how to improve that process. And that's largely what the April webinar will focus on. So take a look at that paper and please come to that webinar with any questions you may have.
Great, well, thank you. There are no additional questions.
Okay, well, thank you all for joining us today. You'll receive all of our contact information in the slides that will be emailed out. So as we said, don't hesitate to reach out. We hope you all are having a lovely St. Patrick's Day and enjoy the rest of your afternoon and evening. Thank you.